Chronic sinusitis is an inflammatory disorder of the sinuses. The sinuses are spaces within our skull and our facial bones that are lined by mucous membrane. That mucous membrane is lined by a ciliated epithelium. Cilia is like, think of it like shag carpeting. And think of your shag carpeting in your living room that would rhythmically beat from away from the couch and towards the doorway and out into the hallway. And that's really what the cilia does within our sinuses. A lot of the inflammatory disorders that affect the sinuses, like allergy, a bacterial infection, a viral infection, or other inflammatory disorders, affects that beating of the cilia. So now think of the shag carpeting not moving the debris towards the doorway. And so what happens then is with the secretion staying within the sinuses, they become super infected, and that leads to the symptoms of sinusitis like facial pain, congestion, nasal drainage, fever, fatigue, malaise, and just generally feeling bad. Many of the patients that we're treating surgically have chronic sinusitis, where they have repeated bouts of sinus infections. It may be the same infection that just never completely goes away. And what usually we'll see endoscopically inside the nose, or we'll see radiographically on a CAT scan, is that the lining of the sinus is thickened and inflamed. It's no longer healthy. It no longer has its normal self-cleaning mechanism where the cilia, or the shag carpeting lining of the sinuses, cleans the sinus. And by definition, that's about a 3-month course where somebody has symptoms that last for 3 months. However, most patients will get better on medical therapy temporarily. They'll take a round of antibiotics and perhaps some steroids and take other medications to treat their sinus disease. They'll get better temporarily, but never fully. And then with the next cold or any type of allergies, or with just bad luck, they'll have another bout of sinusitis. There's been a progression towards minimally invasive surgeries, and I think a great example would be cardiac surgery. 30 years ago, everybody had open heart surgery. Now, the majority of patients have angioplasties or stent placement into the coronary arteries. That same technology is being used in balloon sinuplasty. We'll endoscopically, over a guide wire, place the balloon into the natural sinus opening, dilate that opening over several different areas, and then once we know it's open, we take the balloon back out. One of the exciting things we're seeing with our balloon sinus dilation patients, our balloon sinuplasty surgical patients, is how rapidly they've recovered. I've done thousands of traditional endoscopic sinus surgeries, so I have a good idea of the progression of recovery of patients. And it's really exciting to see how quickly the office balloon sinuplasty patients recover. We're also seeing improvement in frontal headaches, and some of the more difficult sinuses to treat surgically, we're able to dilate the frontal sinuses, for instance, and those headache patients with sinus disease have been some of the best candidates for this type of procedure, and some of the happiest patients. The majority of patients that I see with sinus disease never require an operation. We're able to work on their allergies and other factors in their lifestyle that might improve their sinus problems and improve their quality of life non-surgically. But for those patients that have more fixed disease or anatomic problems that we can correct surgically, there are a variety of options, including office balloon sinus dilation with local anesthetic in the office versus endoscopic sinus surgery for people with different or more fixed disease.